this study found that there's a greater hazard ratio and a greater risk and a greater association with a 5-year loss of muscle than compared to the associated increased risk with having a heart attack or a cardiovascular event with changes in fat mass, gain in fat mass. They say specifically, compared with participants with stable fat mass percentage, those with a fat gain more than 2% over a 5-year period had an increased risk for a future cardiovascular event, and the hazard ratio was 2.7%. In contrast, they say fat-free mass loss greater than 8%, fat-free mass would be muscle tissue. So if people lose more than 8% of their muscle tissue over the course of a 5-year period, this was associated with a higher risk of cardiovascular events. Their hazard ratio was almost double that compared to the fat gain. It was 3.83, which means that you're about 300% more likely to have a heart attack if you start losing muscle between the ages of 50 and 80. As you get older, you should focus on resistance training. You should work on lifting weights. Cardio is good, but a lot of people do cardio at the expense of not having time or energy to lift weights. And that's kind of the thesis of this paper and supporting the health of muscle. You know, we've been focusing so much on fat and the problems with body fat. I'm guilty of this, talking about how fat tissue is a metabolically active organ. It releases adipocytokines and all this stuff. But muscle is a metabolically protective organ, releasing protective myokines. Why aren't we focusing on supporting muscle? And so Gabrielle has really been leading the charge with that. The scientists say that BMI is not accurate. So we should be looking at lean tissue, fat-free mass, muscle tissue, and looking at body fat percentage, not just BMI. And so they say a loss of free fat mass less than 8% was related to a 2.8-fold higher risk of cardiovascular events compared with the stable group. So the people that lifted weights, that exercised regularly, that ate sufficient proteins to support muscle protein synthesis, and didn't lose more than 8% muscle tissue, they still had an increased risk of developing a heart attack, but it was much lower compared to those who did lose more than 8% of their free fat mass or muscle tissue over the course of the study period, and so forth. So our findings imply that one possible reason for the negative effect of weight loss on cardiovascular disease in some research studies might be due to the loss of muscle tissue and muscle mass more than the loss of fat mass. Really important, because a lot of people will diet hard, will cut calories, will do 3, 4, 5-day fasts all the time and lose muscle mass. And as some studies have found, when people lose weight, it actually might increase their risk of a cardiovascular event. And that perplexed scientists for a long time. Well, how could that be? They're losing fat. How could they possibly increase their risk? Well, if that weight loss included loss of lean muscle tissue, that could increase their risk of having a heart attack. And the scientists say, more importantly, it has been demonstrated that total muscle mass peaks at the age of 24 years old. Afterward, muscle mass is maintained as about 10% loss occurs between the years 24 and 50. However, between the years 50 and 80, an additional 30% loss occurs. So if you're between that age category, 50 years old, between 50 and 80, you should be prioritizing protein. You should be prioritizing lifting weights, resistance training, and then icing on the cake would be the cardiovascular aerobic type training, but focus on resistance training. Lean muscle is now independently associated with all-cause mortality, poor COVID outcomes, and now we have cardiovascular disease, the #1 leading cause of mortality. Well, the scientists say the mechanisms of obesity and muscle function in cardiovascular disease have been well reviewed. First, excessive fat accumulation promotes the excretion of pro-inflammatory factors, including but not limited to interleukin-6, TNF-alpha, and interleukin-1, which directly damage the myocardial tissue. So we know that fat is an endocrine organ releasing pro-inflammatory adipocytokines, like I just mentioned, that directly damage the heart. So we know that excessive fat or fat mass is problematic in terms of increasing your risk for heart disease. And in corollary, how does changes in muscle tissue or increases specifically in muscle tissue by way of resistance training and possibly increasing more protein protect the heart? Was the scientists say that muscle tissue acts also as an endocrine organ, releasing myokines. These myokines have been shown to support the metabolic function of the cardiomyocytes, the cells of the heart, and they also release myokines that support the functioning of the vascular endothelium. So we know the endothelium is a functional unit. It's the interior lining, the interior pipe, if you will, of your various vessels within your cardiovascular system. And the endothelial tissue can become dysfunctional in cardiovascular disease. And it's also dysfunctional, by the way, fellas, in erectile dysfunction. Endothelial dysfunction is linked with erectile dysfunction. So weightlifting can actually help support the health of that And these myokines can actually reverse some of the damaging remodeling that can occur in the progression of heart disease in the cardiovascular system itself. And they go on to say that overactivation of the sympathetic nervous system might increase risk for cardiovascular disease. So excessive aerobic training, cardio training, 100-mile bike rides and marathons and all these things, while they may be deemed healthy, they are a source of sympathetic nervous system stress that is unequivocally linked with cardiovascular disease. Here's a study that was conducted in South Korea recently involving 3 million subjects. And what they found is that increases in lean, fat-free mass muscle tissue was associated with reduced cardiovascular events. And they also find that increases in body mass, presumably from increases in fat, were also associated with increased risk for cardiovascular events. So essentially, this study involving 3 million people found similar findings to this study in China. So we have evidence that corroborates here, and we know now that there is a greater increased risk when it comes to having a heart attack for losing muscle compared to gaining fat. I think that is the takeaway here. And, we can look at the hazard ratios of 3.7 for loss of muscle greater than 8% over the course of 5 years versus gain in fat mass more than 2%. And that hazard ratio was only 2. And so essentially what this finds is we need to resistance train. We need to support and prevent age-related muscle loss known as sarcopenia. And these things are not disseparate. Fat mass gain or changes in body composition is also linked with muscle loss. We know that there's this whole phenomenon known as osteosarcopenic obesity, where people gain fat, particularly visceral fat, they start to lose bone and muscle at the same time. It's this triad, and this is quite common. And so this is why we should support metabolic health, normal glycemic function, reducing glycemic variability, having glycemic variability and blood sugar levels that are all over the place, fosters a metabolic environment that actually favors both fat gain and muscle loss.